licensed marriage and family therapist. I've been in practice for 30 years. As true to my title, I am somebody who loves families and is really very family-oriented in my own personal life and as well as in therapy. I like to really understand people's families of origin and where they come from and what kinds of things happen in their family to make them who they are. It's really, for me, really important to see how our families of origin contribute to our lives in the present, for the good and the bad. And for people that have been abused in any kind of way, clearly there's a direct impact and a lot of loss and a lot of grief and feelings that contribute to our everyday life and get in the way. And so again, part of what I do is really look at how those things affect you and how you're going to work through them so that you can move forward in your life in a more productive, happier way.
That sounds great. Did you say, so Laura, I think you mentioned that you also do hypnotherapy. I want to ask about that. I'm interested. I'm interviewing her now.
I am a licensed hypnotherapist. I do therapy or hypnosis a lot for relaxation and for visualization. So there is a difference between visualization and hypnosis. I really enjoy doing it to help people see things in a different way, to give them the ability to imagine things and to create things that are different than what they have, and to start to really believe that they can see their lives in a different way. I also have done hypnosis to allow people the ability to go back and to explore things that have happened in their life and to see them from a different position. And sometimes it's a really great alternative way to try to explore things from the past.
Okay. What made you become a therapist? Like, what was your motivation?
Well, that's kind of not a great question, because I'll tell you why. Because I come from a family of teachers, and the only thing I knew is I didn't want to be a teacher. But I wanted to do something that would be useful to other people.
Okay.
Many therapists go into therapy because they come from kind of bad places. I think I'm maybe one of the more normal. I have a decent family, and actually my brother's a therapist too.
Oh yeah.
But I think it's more about the idea of being able to help people, and again, it is almost like a puzzle or detective work, trying to put the pieces together. What created what, and how did you come to respond in that way, and how you continue to repeat cycles and re-engage in the same kinds of negative things that you knew.
Right.
Does that make sense?
No, totally.